Loved one have potentially a skin cancer and they can't get out to a doctor's office because they're homebound and or bedbound. I'm here to help you. I'm Alan Bienstock, and I am a board-certified plastic and reconstructive surgeon. I specialize in wound care, lesions, and those that are homebound and bedbound. Today we're going to talk about skin cancers or potential skin cancers in the elderly, particularly those who can't leave the home. I've seen a lot of patients over the past 8 years who have potentially had skin cancer or obviously have skin cancers, and it's a question of how to manage this. It can be very challenging. Unfortunately, I have some patients who are 70 years old where the family and we'll say that the social worker don't want to send the patient out or don't think it should be taken off. These are patients that could live 20 to 25 years. These are patients I actually do think need a resection or mean removal of a skin cancer. I'll give you an example. I have a 72-year-old patient who was demented, couldn't leave the home, was actually homebound and bedbound. She had a lesion that was growing on her face. No one wanted to touch it. I did a biopsy and it came back positive for basal cell carcinoma. I had to do 2 excisions to get it out entirely. After the next 4 weeks, it was able to heal by secondary intention. That means it healed just naturally, just with good wound care. So something that looked like it was not feasible because the patient couldn't go out and see a dermatologist, I was able to manage in the home with a few procedures as well as good wound care. Another patient is a 96-year-old woman who doesn't live too far from the Brooklyn Bridge that I was taking care of about 4 years ago. She had this ulcerated lesion that really wasn't bothering her. The son was very upset. The previous dermatologist did a biopsy and it came back positive for squamous cell carcinoma. The patient was 96 years old. It didn't make sense to do a removal since this patient's life expectancy was very short based on all her comorbidities. There's also a risk of doing a procedure, so we didn't remove it. Everyone didn't understand this. Then I found out that they took the patient to a dermatologist, and this is not me belittling dermatologists, but they ended up removing it. She had a major wound complication and had an infection, and I had to go back in and manage a very complicated open wound on a woman who was very feisty and agitated, and this was more challenging than just manage a dry, crusty scale lesion that was due to squamous cell carcinoma. So it is possible to manage patients with skin lesions and skin cancers in the home, even if they're complicated, but you have to choose the right patient. If the patient's elderly and over 90 with multiple comorbidities, it does not make sense to do a big resection. It becomes problematic. It can lead to a surgical wound complication. However, that doesn't mean anyone that's over 70 or 80 shouldn't have some sort of resection. A lot of times my patients can't get out. They can't go for radiation or chemotherapy, but it's okay just to do an excision in these patients, but each case is individualized. Now, if you have any questions about the topic, please let me know. I welcome feedback, and make sure you subscribe to the channel when you get a chance. I look forward to our next session. Thank you.